Hello, my name is Renee Massey, and I work with the Lincoln-Lancaster County Health Department as a tobacco prevention public health educator. Tobacco use is the single most preventable cause of disease, disability, and death in the United States. In Nebraska, tobacco use claims thousands of lives and costs tens of millions of dollars every year. The Lincoln-Lancaster County Health Department works with businesses and organizations throughout Lancaster County, building relationships with key individuals and offering technical assistance on developing and implementing tobacco-free campus policies. 3 of the behavioral health organizations in our community that we have had the pleasure of working with will be highlighting their experiences.
Hi, I'm Mary Berry Magsman. I'm the Executive Director of St. Monica's here in Lincoln, Nebraska.
My name is Phil Tegler. I'm the Executive Director of the Bridge Behavioral Health.
I'm Michelle Nelson. I'm the Clinical Director for Centerpoint. Centerpoint is a private nonprofit agency that provides services to persons experiencing mental health and substance use disorders. We provide a continuum of care. We provide treatment, rehabilitative services, housing for persons that are experiencing homelessness. We are also working on integrating physical health because we are moving towards more of a holistic view of treating an individual.
St. Monica's is a women's treatment program, so we provide a comprehensive array of services beginning with inpatient all the way through outpatient for women and their children.
Well, the Bridge Behavioral Health is a comprehensive behavioral health treatment agency. And that means a couple of things. We provide services in the 16 counties of southeast Nebraska, so Lincoln, Lancaster County, and then all of southeast Nebraska. We are a 68-bed licensed substance use treatment center, and we provide a range of services, primarily withdrawal services and treatment and recovery support for our clients in support of our mission.
St. Monica's had been talking about the issue of tobacco for many years, and of course struggling with that issue of we allow this addiction, but we're helping women with other addictions and not allowing those. And so we talked about it a lot. We'd looked at different programs, we had attended sessions, but in I think the fall or end of 2013 we actually attended a summit. The National Council for Community Behavioral Health had put on something specific to smoking cessation and how a behavioral health organization could go about moving to being tobacco free. And that really kind of fueled the fire, so to speak.
We know that clients in treatment often really do want to stop smoking, but frankly they're just not able to do so in an unstructured environment. And so research says that often clients that are coming into a treatment program are dealing with enough issues that smoking really becomes a hindrance for them. And so we thought it was important to move forward in our treatment program. It's difficult to ask clients to address their addictions without addressing the addiction of tobacco. And so it just made sense to us to think about how we implemented a smoke-free program so that our clients, as they're dealing with their addictive behaviors, can incorporate that smoking behavior at the same time.
We recognized that 40% of individuals that smoke cigarettes are individuals with mental illness and also substance use disorders. What we also know is that 25% of persons who are experiencing severe mental illness and substance disorders die sooner than individuals that aren't experiencing those issues. And so we felt to have a more holistic approach that we wanted to move towards a tobacco-free environment, to provide a healthier and safer environment for not only the persons that we serve, but also for our employees.
We also did our research to see what resources were available to us, and I would recommend that anybody who wants to do this does the same. There is the Nebraska Quit Line, and I'm sure that's available in every state. We used our Lancaster County Health Department. They were an amazing resource for us, and they came back over and over again. They not only helped us get started really, but then they continued to come back and have done support groups with our clients, have done education with our staff. And at that point, we also invited our peers, so providers in our Lincoln area who were also considering or had planned to go tobacco free. We invited them to some of those sessions so that we shared that time and resource together. So really it's, you know, whether you spend 6 months or 2 years planning, it does take time, it does take planning, but there are great resources out there, and I would recommend if you're thinking about it, start there. Start looking at what your resources are and use them because they're there, they want to help, and they're phenomenal. So that really made a big difference for us in both the planning and the implementation, and I think now even as we move forward, we continue to look to those resources. So we still feel like our county health department is a partner in moving forward.
So we started our program really in 2 stages, which I think was a good way to do it. We actually implemented a smoke-free policy for our staff a year ago in January. So it's been about a year and a half now, and we wanted to make sure our staff were involved before our clients got involved. So then we implemented the program for our clients in January of 2014.
We also developed a committee, put a committee together that really focused on this topic so that we had staff and consumers from different services that were providing feedback and input into doing this. We developed the policy, we had staff and consumers look at it, and then it went through our board and had to be approved before it was implemented.
We developed a curriculum for the smoking cessation. We looked at would we prescribe NRTs? If we were going to do that, how would we fund it? And so we had to start looking at were there available resources in our community, were there grants available that we could actually fund purchasing the NRTs, whether that was nicotine replacement or patches. There were different things we used. We had to do, you know, the simple things like signage for the facility. So what, you know, it even came down to what sign did we like, and staff voted on which signage they thought best represented us and would look best on our facilities, and where would we place those. And so we went through all of that, deciding what signage and where it would be placed. And then of course we did some kickoff activities. So we tried our best to involve everyone, to make it as fun as we could. So it included treats and festivities and kind of a positive, upbeat kickoff. And that's really kind of was our first, all the steps we took to kick this off.
First of all, we had to do our homework. And so we really had to do a couple of things. We had to survey our staff and our clients to make sure they felt that this was important as well. It's a lot harder to move forward if you don't have commitment for the people that you're working with. So we began by doing surveys, and the feedback we got, interestingly enough, was that these folks were excited about the opportunity. A lot of our staff and of our clients really did want to stop smoking, but they didn't feel like they had the structure, really didn't know how to do it, didn't feel they were involved in an environment that would support them in doing that. So the first thing we did was to do surveys. And overwhelmingly, our clients said, I'd like to stop smoking. And they had great examples for areas where they knew smoking was an issue in their lives. And so then the second thing we had to do was do some research. And we did a couple of things. We talked to locals, groups that had already been through this process. So we interviewed several nursing homes and hospitals and other healthcare facilities on how they had moved forward and learned some of the things they had done well and some of the things they had identified were problems. We also interviewed some national providers. There are others nationally that have done this, that have done a great job. There are some states that really support this initiative among all of their behavioral health providers. And so we talked to them about how that process had worked. And then the third big thing for us was to plan and plan and plan. And we talked to some great resources. The Lincoln-Lancaster County resources are fantastic. There are others in town that have a lot of good information. And we had to do a lot of planning to make sure that we knew how we wanted to go about this. And then wrote policy and procedure. And then finally, we did a lot of education. We went back to our staff and talked this process through. We went to our clients to make sure they knew what to expect and what we were going to hold them accountable for.
You know, I'll be frank, it has been difficult. Initially, I think what we hoped would happen and what really happened were not necessarily one and the same. I think like any new initiative, you don't think of everything that could possibly happen, or if you do, sometimes you were just wrong. And so we had to go back to the drawing board on several occasions and relook at some of our policies, relook at, I know specifically for us, it was, we serve a lot of women who have trauma in their background. And our clinical expertise really started to point out to us, we didn't take into consideration that trauma. And those women who have high trauma probably need to be looked at differently in this process. And we may need to do a little bit more work up front, and we may need to provide them some more options, some different ways of handling if they in fact smoked or used some kind of tobacco while they were with us. So we just had to really kind of continue to work it, continue to look at the policies, and continue to kind of fine-tune how we were addressing the infraction without being too punitive, without kind of re-traumatizing women in our process. So I would say we continue to relook at everything we did and continue to improve how we went about it in every way, in our process, in the products we used, in training with staff, in our education with the women.
All in all, the feedback we get is that it's been a good process for us. One of the things that's been surprising is before we stopped, how much time and effort we took to try to coordinate our efforts to have our clients smoke. And in a treatment center where every minute of the day is scheduled, you actually had to build in time. And what's been a blessing for us afterward is to think of all the time now we have to spend on more important things than to do that. And frankly, our clients feel better. They feel like it's more important for them, that they've gained a tool to help in their recovery, and we think our campus is better off as a result.
Overall, I think our experience has been pretty positive. Where we've had some challenges has been in our residential programs. And those programs are where people come and they stay in our facilities, some long-term and some are 30 to 45 days, and they tend to have some difficulties. They don't always want to give up smoking when they're coming into treatment. What we have found is that we were surprised by the number of individuals that were happy about us being tobacco-free, and they would say, I can really work on quitting now.
Wow, the advice I'd have is hopefully to follow some of the things that we got advice on when we started. Number one, really spend time researching, knowing what you want to do. Think about policy. Think about how you want to include. What does a smoke-free campus mean? Does it mean not in the building? Does it mean not on your property? How will you support that? How will you supervise it? Can people smoke in their cars if they're on their property or not? So really do your research. Think about what you want to try to do, and then spend time planning. There are great resources in our community that can be supportive of this, but you have to reach out to them. You have to talk through with them what you want to do, and plan and plan and plan. And then the third big thing, I think, is to educate ahead of time. So go back out to those stakeholders. Make sure that they know what you want them to do. Make sure that they know what you intend to do, and that you intend to be consistent, you intend to follow through, and that you always want feedback, so that as they stumble or they find issues, they can report back to you, and that you're going to be open enough to consider how to address those and move forward. And I think those help to make a successful program.
I would say don't give up on it. It's not as scary or quite as hard as you might initially think, and it's very rewarding. And out of 10 people, if you get 1 to 2 people that quit or even cut down, we need to recognize those as steps forward and accomplishments.
So you have to continue to do the education, and you have to hold firm. We felt like there were times when there were staff who were really being pushed by the clients to stop or to maybe lighten up. And we felt like staff were kind of trying to see if maybe we would we think about going back and not doing this again, or allowing them some time to smoke, and I think you have to hold firm, and you have to say, if this is really what you want to do, then you have to live through this hard stuff, and you have to kind of hold the line and continue to offer support. Do whatever you can to help those staff that have to deal with the women or the clients on the weekends and the evenings when it's hard. Do what you can to help them. We started some incentive programs where when the women were doing well, we rewarded that behavior with some fun things. And you'll get there, but it's not a quick thing. It's not an overnight thing. Like any big change, it's a process. And when you're doing a change personally, it's hard and it takes time. But when you're doing it as an organization, magnify all of that. It's going to be harder. It's going to take more time. But you can do it, and you just have to keep plugging away and holding strong, because it's the right thing to do.
My belief is really this is where the field of behavioral health is moving. I would say 10 years down the road, you're not going to see very many treatment providers, treatment centers that aren't tobacco free, because the field is moving towards treating the entire person, not only the mental, the substance, but the physical health. We have to address that to really help people be better sooner for longer.
Breathe free, live healthy, and enjoy fresh air.